Thank you again as we continue. So we acknowledge the response uh, of one of the students, or Miss, I forgot who responded a while ago. But anyway, so with the public health, it's the 82%. I know that you have prioritized this because there are many issues and challenges that are being encountered in this level. So um, with the 82% and 18%, no responses for clinical hospitals and nursing education. Probably, I think we really need also to take into considerations or probably you're thinking nursing education because most of the schools have already established their flexible learning system platforms. For clinical hospitals, hospital information system has been established. But since in the topmost priority, hoping the government will facilitate the funding on the public health and the government agencies in particularly will set the standards to adopt the health informatics in these areas. So thank you very much for your responses. Now, the next topic that we're considering is are the areas or the specialization that we consider nurses to be involved in health informatics in most of the facilities. So let us now have the difference of the nursing informatics and clinical informatics. In nursing informatics and informatics as well have been defined as the science, right, of using the principles of data, information, and knowledge. So in nursing informatics, nurses being involved at the bedside have considered various activities, and which, as the one who is having the hands-on performance of the functions and responsibilities with the patient, we are more oriented and tasked to do documentation to our patients. So that's why in nursing informatics, anything that we process for information, retrieval, access, storage, and management of patient care and documentation, these are the processes that we involve the technology and nurses as well. And it is being called as nursing informatics. So we are more focused on our tasks as nurses. Now, if we have the clinical informatics, in clinical informatics, the information is provided to caregivers. So meaning the perspective by which it considered the the involvement of not just nurses, but if this information are being accessed by the other healthcare professions, non-healthcare professionals in the hospital, so what the core beneficiaries of care who are patients information are being shared. This is on clinical informatics because the nurse is now sharing this information to the doctors, sharing with information to the administrators, sharing information to the concerned department that is in particular have a direct involvement in patient care. So that is the clinical informatics. It involved other professions, while in nursing informatics, it involved nurses as they discharge their functions and performances. Now, that's why in the implementation of the health informatics in most of the hospitals, city health offices, and other healthcare facilities, we've considered positions such as Chief Nursing Information Officer and Chief Medical, that's Information Officer. So again, the Chief Nursing Information Officer, since we have nursing informatics, so she is more focused on the involvement of nurses, specifically in the nursing services department. It is not just only for those who are in the front line, but also the middle managers who are our head nurses and charge nurses, and nurse administrators who are our nursing directors, chief nursing officers, or chief nurses. So the chief nursing officer, information officer, heads a specific task on the monitoring of the processes and information using a specific platform that is being managed for the hospital information system. Now, the 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 role of the chief medical information officer is more broad in scope because this may not just only involve all the medical practitioners who are doctors, but also the other healthcare professions and the health department. So that's why the medical information officer is more broad compared to chief nursing information officer. However, what made to consider that why we have more chief nursing information officer rather than other departments, because almost 60 to 70% of the composition of the human resources of the hospital are nurses. So it is very relevant to consider that there must be someone who manage or who manages this processing, because we need to follow standards. If these endeavors are still with the Data Privacy Act, if these endeavors are still with the institutional protocol, it is the role of the Chief Nursing Information Officer in the nursing service. While overall, including the nursing service, is the Chief Medical Information Officer. So that's why in the nursing service, most of what I have mentioned is dealing with the patient care management. So that's why nurses are more involved in the processes or the evaluation of the IT products. Kaya if there are biddings when it comes to the hospital information products, nowadays we have Bitsbox, there are other outsourced providers, nurses are being involved because we are immersed, we are more trained, and had the expected competencies, have already the expected competencies in the process of the information system in the nursing service. That's why if we have electronic health records, workflows that where nurses are being involved, nurses can definitely respond to it. While on the medical, on the day-to-day basis of patient care that involve nurses, doctors, and other healthcare professionals, including the non-healthcare personnel, it's on the medical, okay, on the medical department that they consider this as a whole in the operations of the hospital. While on the nursing service, it's more on the processes and important important aspect of the hospital information system, including the EHR or the electronic health records. Sometimes they are having EMRs or electronic medical records. Now, I will be showing to you, or I will be presenting to you an audiovisual presentation or visual or video rather, a video recording of the opportunities that you may consider in health informatics. It could be in the entry, immediate, or expert level. And it will also emphasize and reiterate, it will also emphasize in this video presentation on what are the expected competencies that you may need to consider if you wish to enter into the if you wish to enter particularly in this profession as informaticists. So this is as disclaimer, this video is presented by University of Texas. And their programs are also geared towards on how it will develop competencies of nurses and other healthcare professions who wish to be involved in the health informatics. Let us watch.
Today we are here to talk about the exciting opportunities in the field of health informatics, otherwise known as HI. You may be more familiar with the name medical records. In the past, medical records consisted of handwritten notes, x-ray and laboratory reports, and other information, all documented on paper and put together into one file, which was then put into large rooms. Whenever the need arose to review the records of a specific patient, the patient's file would be retrieved from the filing room and delivered to the requesting physician or clinician. Today, the U.S. healthcare industry is trying to implement health information technology for all providers and related businesses. This requires a new workforce with specific training in health information technology. So, what specifically is health informatics? HI is the application of information processing involving both the computer hardware and software. It deals with the storage, retrieval, sharing, and use of healthcare information, data, and knowledge, including its communication and for decision-making. Nothing in healthcare occurs without the information. For example, when we go to the doctor or the hospital, they take down certain information such as height, weight, or blood pressure. This information often includes diagnoses of conditions we may have, as well as lab results and prescription medications. A term you might hear when people are talking about health informatics is the electronic health record, or EHR. The EHR is a real-time patient health record with access to tools that can be used to aid clinicians in decision-making using the most current knowledge available. The EHR can automate and streamline a clinician's workflow, ensuring that all clinical information is communicated when and where it is needed. So, where do health informatics employees work? They work in a variety of settings, including hospitals, ambulatory care clinics, private physician practices such as your doctor's office, skilled nursing facilities, and military MVA facilities. They also work for EHR vendors in which they help to develop, program, sell, and implement the various EHR products. Or they can work in higher education, meaning in universities and community colleges, as educators, researchers, and innovators of health informatics. What kinds of roles do health informatics workers fill? Again, many different ones. For example, at the entry level, one can choose to become an HIM clerk or medical records specialist, in which one primarily works with the patient records. Typically, the education level necessary for an entry-level role is a 2-year or associate's degree. Or they can choose an intermediate role, including supervisor or manager, data analyst, or implementation specialist. A data analyst uses statistical techniques to rearrange health information into patterns and categories that can be useful for many different purposes. An implementation specialist is someone who installs hardware or software for the healthcare organization. Usually, in order to be in an intermediate role, you need a 4-year or bachelor's degree and applicable work experience. There are even advanced career levels on the HI pathway. Some of these include a quality director, who is responsible for ensuring the organization is meeting its patient care quality goals, or a chief information officer, or CIO, leading the IT investment and implementation strategies, or a chief knowledge officer, CKO, someone who is responsible for converting data into knowledge the organization can use. Someone at this level has a bachelor's or master's degree with lots of work experience. These people really are the experts. What kinds of skills do you need for these roles? There are different categories of necessary skills, such as technical, workplace, academic, and personal effectiveness skills. For example, a technical skill would be to have some knowledge of medical terminology, to know the language of medicine and related words. Have you ever heard a doctor read your blood pressure? Usually they say something like 120/80, and you think, what does that mean? Learning medical terminology would help. It is important to keep health information private and secure. This requires the knowledge of the applicable laws and regulations. What about workplace skills? They are also necessary. Collaborating or being able to work with others is critical when you are assigned to a team and you need to finish the project together. Knowing what the different HI products do and how they can be used most effectively in a variety of settings is also vital for HIT workers. Academic skills are also important. You must be able to read and understand assignments, memos, and other deliverables given to you from your supervisors. You must also be able to write clearly and concisely, as well as think innovatively in order to produce results. Personal effectiveness skills are important. This means being able to work together as a team, effectively communicating, showing up to work on time, and proving you are dependable. And you must also be able to demonstrate adaptability during assignments or projects. So what type of education is available in Texas for health informatics? There are 2 Bachelor's of Health Information Management degree programs available in Texas. One is available at Texas State University in San Marcos, and the other at Texas Southern University in Houston. Both offer campus classes where the students enter as a junior, having already completed their Texas-required core classes. Texas State also offers its classes in an online format. The 4+1 program is a dual program between UT Health and other four-year universities. It is open to students pursuing an undergraduate degree in biomedical sciences, biology, nursing, mathematics, and computer science. While enrolled, the 4+1 program students will take 5 courses with the School of Biomedical Informatics that will constitute a graduate certificate in health informatics. At the conclusion of their undergraduate degree, students will have obtained both their bachelor's and the graduate certificate. Those students who wish to continue on to their master's degree will have only an additional year of classes instead of 2 years to complete a master's degree. The master's and doctoral degree programs are both available from the University of Texas Health Science Center School of Biomedical Informatics at Houston. We offer a Master's of Science in Health Informatics with a traditional and applied track and a Doctor of Philosophy degree in Health Informatics. For additional information regarding our academic programs, visit our website at sbmi.uth.edu/apply-now. It is safe to say that health informatics is an innovative field, and there is a high demand for HI workers in the nation, with up to 50,000 new jobs. A recent study estimated that Texas would need an additional 10,000 workers in health informatics. There are many opportunities out there. HI, or health informatics, is a fast-growing field with more jobs added than any other industry. From 2007 to 2011, health informatics jobs have grown faster than many other fields. The U.S. Bureau of Labor Statistics is also predicting large growth in this field for the future. The need for health information technicians is expected to increase by 21% between 2010 and 2020 in response to increased demand for health care and increased use of technology in health care. Remember though, while training and education in health information technology is important, many employers are looking for that health care piece in health informatics. Although IT is an integral part of HI is different than IT. In healthcare, the lives of the patients, you, me, and our families and friends are at stake. The technology implemented can change the way care is delivered to patients. Healthcare employers are going out of their way to hire health informatics professionals instead of IT professionals. All in all, there is a lot of opportunity for a career in health informatics. We hope to see you soon at the School of Biomedical Informatics.
Okay, as a disclaimer, again, I am not connected with University of Texas. However, I just found that their presentation is very relevant in our topic, and I think if those information are very relevant for us to be more enlightened, and it was evidently presented, and one of the highlights of those video presentation is certainly that the continuous increase of the health informatics jobs have increased. And it was mentioned in the initial video presentation that we have is by 2024, that will be next year, there will be an increase in the demand for the health informatics. So uh, in this perspective, the healthcare informatics benefits will definitely benefit from the following. This has been considered as a potential method because it's an access on the real-time information. And as what I have mentioned, this has been a method on which even pre-pandemic we have already started online classes in nursing education, teleconference, teleconsultations have been in place even before pandemic. It just strengthened and enhance those platforms and those delivery of these services through the use and maximization of the healthcare informatics. The next is that of we have mentioned in the definition of health informatics is mitigating error or minimizing errors. Through the use of the electronic health records, we have maximized the use of computerized functions. Nowadays, to protect our patients, and for our patients and even healthcare personnel to access the services of the hospital, it becomes more efficient through the use of barcoding. We have used the barcoding so that when you will have a barcode reader, then it will direct you to the site, to the platform, to the information that you may need. And we have the electronic health records medication reconciliation. In the electronic health records medication reconciliation, it is connected to the various departments from the central supply room, pharmacies, accounting, nurses station, medical, because the stocks of medication and drugs matters. In case that there is no stock anymore, then it will alert the purchasing office. The central supply room will update the stocks and inventory. The pharmacy will be responsible for the dispensing of the medicines or drugs that are being used for hospitals, for the hospital and patients, outpatient or inpatients. And the nurses are the ones responsible for the administration of the drug and recording of any adverse reactions. The doctors are being updated through the use of the electronic health records on medication reconciliation on the perspective of updating any discontinuation or changes in the pharmacological management of the patient. Computerized healthcare provider order entry. This will facilitate, for example, if the patient wish to have a schedule of appointment for consultation, the computerized healthcare provider can already consider these services in advance so that you are expected to have the blocked schedule for your consultation. Other than that, we have utilized the healthcare provider. The nurse can already consider the point that if you have the skills in the information technology. So I think you can have the involvement in putting up an application or in designing an application or system that can be utilized by hospital. This may consider as a contribution in the hospital. That's why again I'm challenging everyone, hoping in when you have your nursing research, think of a problem which we have already identified almost 78% of your responses in the public health, then think of something that will translate into an application. And if this application could benefit our communities, that will really help. Example ha, one of the observations that we have is there are communities that still increase ang mortality rate of high risk pregnants. And I think it could be very significant if you will design a platform, mobile, that can be accessed through Androids to identify uh, pregnant women who are high risk in that community, so that it could be very helpful for the health centers and nurses, public health nurses, to reach these patients. And we will not wait anymore for emergency situations, but we will consider that they are high risk on the perspective of monitoring and on the perspective of strong health education. So I think if you will make this research and put this into an application, it will really benefit. Ha? So magiging more outcome driven tayo in our researches. So hoping this will already expound your conceptual framework in your future researches. I also mentioned this to other sections. Patient care alerts and reminders are also being used for electronic health records. Just like sa mga home care facilities of elders, usually we expect that for ambulatory patients, we see the situation that they are always with the presence of the caregiver or a nurse. But now, if the elder is an independent individual, they could just manage to have a digital watch, program their medications by the nurse, and it could facilitate eventually the information that once it alarm, it means there is a due medication, and the nurse can have the video call so that to facilitate and validate the correct medication and the right route for the administration of medication. So I think these are another microchips that are placed in the being placed on the clothes of the patients. It identifies already if it alarms a problem with oxygen saturation, and thus the patient could be high risk of chest pain or heart attack. So these are, I think, things that we'll need to explore in the almost sixth industrial revolution. So nurses, future nurses, I'm challenging everyone to already conceptualize or researches in relation to health informatics. Other than that, we always take into consideration if the information will be translated into useful information. So it will definitely consider quality exchange of information. All of those authorized persons who can have an access can definitely consider how they will contribute to individuals, families, and communities, which we are oriented as well, di ba? Then next is it provide engaged patients and families via personal health information portals. So I think this access can already be available once you are being registered in a particular facility and the continuous services that can be provided by the hospital on the extent that this will engage our patients to be more interactive with healthcare personnel, with hospital administrators, so that it could improve particularly their services, and on the premise that it will consider the extent of how it will have continuity of care. Another is it improve care coordination among healthcare personnel, a healthcare team. The point of having or the access of the electronic health records can already been accessed within the premise of the hospital or even outside the hospital. So the accessibility itself matters when it comes to the immediate care management. Next is if the city health offices will be connected to the health centers and if they have established the electronic health records. Another example here is, for example, a nurse, or rather a patient, a pregnant mother who have the most of her maternal consultations in the province, and she will be scheduled for her delivery here in Metro Manila. So so the problem is that of if the patient is in pain and cannot anymore perceive questions and respond accurately, I think the time element could be considered efficiently if the hospital already will be given access to the facility in the health center on the records of the patient. But seemingly, if they do not have those records, those history, they need to ask again from the time that she had consulted and until the recent results of diagnostic examinations. The patient may not have all these documents when she visit another facility. So I think the electronic health records can really help. So I think the first part of our discussion have already ended here. We will proceed to the topic 1B. So I'll just stop my sharing. So for the meantime, do you have any questions? Any clarifications on this? Any clarifications? Do you have any questions? If you have any questions, feel free to consider, because questions are definitely entertained and open venue for us to consider clarifications, because it will open also a learning experience for me and for everyone po. So I'm hearing none and I'm seeing no raised hands as well. So we will proceed to the next the next discussion that we will have for the topic 1B. Okay, let us proceed. So again, hoping everyone still could still have the energy and stamina for our learning sessions, and this is very important because we are considering this subject even though it's still a professional course, but I know this will really consider the perspective that it will really help our future professions as well. Even in the Philippine Nurses Association, we are greatly emphasizing the health informatics for nurses. And these are global trends nowadays. Okay, so let us start again the second part of the topic. We still have 10 to 15 minutes of our second session. Okay, let's start. For the topic related to the health informatics, we will now expound on the discussion in relation to, I'm sorry, in relation to nursing informatics. So, but for a while, let's stop sharing. Okay, I will post the right file. Mhm. Okay, I think this is the right file. So let us continue. Okay, so let us continue with our discussion on nursing informatics. The topic that we will consider now is on the emphasis of data, information, and knowledge. Again, the this presentation has been uploaded in the Neo LMS, and particularly there are two versions that we may have or that have been uploaded in the Neo LMS. We have the PDF file which can be downloaded, and the one that can uh, that can be viewed in the Neo LMS. And this recording will be uploaded the soonest that it is available, so that for your review. So to continue, we will have again an interactive session. Okay, for our interactive session, join again the slido.com. We have 3579619. So let us just wait for the projection of the question. Okay, so I think we missed that. Okay, for a while. I will just check the projection. Okay, so let's stop sharing first. For a while. Okay, so I will register it again because it hang the presentation. Just wait for me.